Hi, everybody. We're live. Welcome, everybody. Welcome to join the County of Santa Clara Live Speakers Series with our Critical Care Department at the O'Connor Hospital. Today, we're going to learn more about our nursing department. And my name is Oriana. I'm a senior recruiter at the Employee Services Department of the County of Santa Clara. So this virtual event will actually be saved on both of LinkedIn and Facebook. So everybody can watch this at a later time. If you have any questions, feel free to drop your questions in the comments section so we can answer them accordingly. And who we have here today are Juana Castillo, our nurse executive of O'Connor Hospital. Hi, Juana.
Hi.
And we have Karen Sake, our ICU nurse manager, and her passionate team members. Hi, thank you, everybody. And I'm going to first introduce Juana. She's our nursing executive at O'Connor Hospital. She has been a nurse for more than 22 years. Out of those years, she has been a nursing leader for 17 years. And she's been with O'Connor for 7 years, and she oversees the whole hospital's nursing departments. Let me hand the floor to Juana so she can introduce the team.
Thank you very much, Oriana. So again, I want to say welcome, everybody, and thank you so much for being with us this morning. And I have the distinct pleasure of introducing our awesome team. First, I'll introduce Karen Stake. She is the nurse manager for ICU, and everyone will share a little bit about themselves. But we also have some of our wonderful nurses on. We have Beth Payne, and we have Gretchen, who is also going to be joining us, I think, just via voice. So again, thank you. And just to what Oriana says, it has been wonderful being here at O'Connor for the last several years. It just feels like I blinked and it's been that many years. So look forward to having an opportunity to share more about the hospital with you. And we'll get to questions after a round of introductions. So Karen, go ahead.
All right. Hi, everybody. Just to let you know a little bit about myself. I've been here at O'Connor for a year and a half, and but I've worked at lots of places in the Bay Area. I've worked at Stanford. I worked at the VA hospital in Palo Alto, and I also worked at El Camino. I've been a nurse manager for, I think, 7 years now. And, I really enjoy O'Connor. And, it's what's great about O'Connor is it's a small community hospital, but it's within the larger county health system, which has a lot of benefits with it. So, um, you know, I'm going to go ahead and then let Beth and Greta introduce themselves, and then we'll get into more about why we like O'Connor and why we would love to have you come join us. So I'm going to turn it over to Beth, one of our clinical nurses here in the ICU.
Hi, everybody. My name is Beth Payne. I've been a nurse for 14, almost 15 years come May. I've started my career at the Mayo Clinic in Rochester, Minnesota. I worked there for 7 years, and my specialty was pulmonary medical ICU. I travel nursed after that. I went to Stanford. I've been to El Camino. I've done some international nursing. And I ended up here at O'Connor for the past year and a half, and I just really, really love it here. So I was happy to be able to join in and just tell people why I love it here.
Thank you, Beth.
I'm not sure that we got Greta on, so I guess we can go on to.
Oh, not a problem.
Yeah.
It's okay. We are experiencing some technical difficulties. That's totally fine. Thank you so much for your introductions, everybody. And I think you already brushed up on how awesome the hospital is, but let's elaborate on that.
Sure.
Let's chat more about how is it like working there. And let's start with Juana. Can you tell us more, Juana, about the hospital and why do you enjoy working there?
Sure. So just a little bit more fun facts about O'Connor. O'Connor is one of the oldest hospitals in the county of Santa Clara. It was founded in 1889, and I can guarantee you that if you ask someone, they will know someone who was born at O'Connor. That's our legacy in the community. We're 358 beds. We are growing and growing and growing. As you may know, we joined the county of Santa Clara in 2019 and are part of the county system, and our other hospitals include VMC and St. Louis. So it's a great organization. O'Connor specifically, we have a lot of specialties, obstetrics. We have a level 3 NICU. We offer cancer care in addition to a lot of outpatient clinics, including our award-winning wound care center. So from the clinical side, we are doing really great things, and I'm going to let Karen and the ICU team speak a little bit more about our cardiac program, which again has been growing in the last year. We've started TAVR program, and we've got a lot more on our vision. Our goal really is to become the cardiac center of excellence for the community, and that is a goal that I know we'll be achieving in the next few years. A little bit more about why I like working at O'Connor. I always tell the story because it really sticks out to me. When I first interviewed here years ago for the role, I was here early and I just wanted to kill some time. So I went over to the cafeteria, and everyone I would meet would say hello. And it was good morning, hello. And at first I was kind of confused, like, what is this about? And that really is just the culture. And if you ask anyone, that is one thing that other people who are new to our hospital say. Everyone says hello to each other. Everyone says good morning. And that is part of who we are. And that's part of that community feel and definitely family feel. So that's one of the things I would say that I really enjoy about working at this hospital. In addition, I'd like to share with you a little bit about our nursing philosophy. We very much promote education. I'm a big supporter of education. And in fact, I'm back in school this year. Went back for my doctorate in nursing practice to just better be able to help support our nurses and our clinical care here. We're very patient-centered. Everything we do is about the patient and for the patient, and that really is what we look through the lens of. And I can tell you that that's not the case in all organizations. So we are truly lucky that when we talk about doing the right thing, the definition is what's the right thing for our patients. And again, about caring for each other. I mean, truly, the teamwork that's displayed on all the units, including the ICU, they very much care about each other and taking care of each other. So I would say that, those are the things that make this hospital outstanding for me. And again, we'll make sure we leave some time to answer questions, but I'll hand it over to Karen to talk about the department specifically.
Okay, so I'm sure all of you want to know what's our ICU like. So it's 22 beds, and so we have intensivists that are here 24/7. And most days with the census that we have 2 intensivists on, which makes it really nice, so they don't get overwhelmed. And we see all sorts of. We're a combined medical surgical ICU. So, but like Juana said, we are really trying to grow some of our programs. Our OR is, and cath labs are seeing more and more patients, and we're now doing TAVRs. We went from 1 CV surgeon to having 3 CV surgeons here doing procedures. So, that's the great thing about O'Connor is we're growing, and it's exciting to see this hospital grow. And so if you're a nurse that's been a nurse for a while and you're kind of getting bored with ICU, this is kind of a neat place to work, because you could see different patients all the time if you really wanted to. But if also you're a newer nurse looking to come in, there's lots of growth potential here to learn a lot of different things. To learn open hearts. We are seeing Impellas, balloon pumps. We started a CRRT program.
Mm-hmm.
And I saw some people commented in the comments about staff development, and Juana mentioned education. We just put on a 3-day class, like 3 weeks in a row, to get most of our staff through a open heart surgery training course that was led by a nurse practitioner, and he also is an RN first assist in the OR. So just a lot of exciting things going on here. That's why I like working here, because it's just exciting to see the future of O'Connor. The other thing, when I talked about our intensivist, we have a great group of physicians. They're all very approachable, they know the nurses by their first names. Everybody knows each other. Like Juana said, it's like family here. And it feels like that with the physicians too. And, you know, sometimes you can feel like there's that hierarchy, and I don't feel like that with these physicians. They're really awesome to work with. Let's see. Let me see if there's just any other thing I want to stress. No, I'm going to turn it over to Beth and just let her tell you guys why she likes working here.
I really love working here for probably the biggest thing is teamwork. The physician team is so approachable. I can ask them any question. I can approach them about any topic for my patients, and they'll answer it and they'll take it seriously. And then I'm able to do that again and again as much as I need to. There's no fear or anything like that. It's just a really wonderful team to work with. I also really just enjoy working with my colleagues. I feel like we have so many amazing, wonderful personalities and people that just really support and don't let you drown. And as an ICU nurse, I've been an ICU nurse for like 10 plus years now. And I have struggled on my own with patients that were overwhelming. And as long as I speak up and I don't suffer in silence, I will always get help here from my colleagues down the way, from the research nurse, from the charge nurse. And that's just a really beautiful place to be, is when you have that team that will come around you and support you, and vice versa, where people can tell you they need help and you can also, give that back. I've been really happy. I know I've worked staff at a couple other places, and that here, the progression you get to have as a nurse on the floor is pretty amazing. There aren't picking and choosing who gets to do what, and who's going to be able to be a heart nurse, who's going to be able to do a CRT nurse. If you're interested and you're willing to put in the work to become excellent in that particular topic, that avenue is open to you as the classes are available, which is really, really cool. That's not always the case in all hospitals, and I think that's really cool. So I work with the CRT program. It's really exciting to be starting that. We're just getting an Arctic sun, which is pretty awesome. I know that's kind of basic for a lot of hospitals, but it's pretty cool to be part of bringing it on and being part of that, of setting up the program for that. I work with a lot of the heart programs. I'm hoping to go through the open heart orientation here in the next year or so. But we have been training a lot of open heart nurses, and that's really encouraging as a staff nurse to see people cycling through and have opportunities to do that, and to know that those doors are open to you as well when you're ready and when there's time for it. So I just love it. I was telling Karen a month ago, it's I'm so interpersonally happy here that it's really cool. I've worked at some pretty awesome places. I've worked at the Mayo Clinic, I've worked at Stanford, I've worked at Camino as staff, and there's a lot of really great things about those places. But here, I feel like the teamwork is just so amazing that it just makes it makes me happy to come to work. So that's what I have to say.
That's so awesome. Thank you, everybody, for sharing that. That's what I know about O'Connor as well. It's super friendly, welcoming, family-oriented, and everybody knows everybody. And when I walk in the cafeteria, I just hear people say hi all over the place. I love O'Connor Hospital. Thank you, everybody. And I do see questions already. Thank you, everybody, for dropping your questions. I see one that's asking if this is geared toward hiring nurses. Yes, it is geared toward hiring nurses. And the purpose of this virtual event is for everybody to know more about this hospital and our nursing departments. And Joey asked a question. As you know, courses are expensive at the moment with this pandemic. I'd like to become the phlebotomist. How do I accomplish this internationally? Would anybody know the answer to that?
No, sorry.
Sorry about that. How long have each of you worked there? That's a good question. We would like to know more about your history with O'Connor Hospital.
So I've been here for a year and a half, and I think you've been here almost a year and a half as well.
Mm-hmm.
Yeah.
Great. And Juana?
I've been here almost 4 years, actually.
Oh, 4 years.
Yeah. But again, it just, it went by so quickly since I first joined here. And again, the amount of growth that we've done in the last few years. One thing I am personally proud of, and again, as Karen says, although this may be some standards in other hospitals, with the team in the ICU and Karen's leadership, we were able to establish a rapid response team. So we don't have our ICU nurses that have to leave the units. And that's something that was important to me when I first got here. And it took us a little bit with the pandemic, got in the way for a little bit, but we were able to accomplish that. And as Karen says, they've launched the CRT program. We've launched the TAVR program. And this is all in the last few years. So we are really excited. Not only we look at what we've been able to do during a pandemic. Now, can you imagine, what we're going to be able to do going forward? So very excited about that.
Thank you, Juana. I think I'm so glad we're having this virtual event because from what I know, not a lot of people in the community know about our hospital and our awesome programs. I think this is a great opportunity for us to share what we have. There is another question. Do you hire Lvns?
Not for the ICU.
Not for the ICU, yes. That leads to the next topic that we wanted to discuss, which is what are our current openings? Because the hospital is so awesome. People are probably wondering, how can I apply right now, today? Let's talk about that. Let's chat about our current openings. What are we looking for? We can talk about the shifts, hours, code sizes, day-to-days, anything you would like to share with everybody.
Okay. So we have 11 vacancies right now, and I think it's kind of half and half, day shift and night shift. Our day shift starts from 7 a.m. and goes until 7:30 p.m., and then our night shift starts at 7 p.m. till 7:30 a.m. The code sizes are, most of those vacancies are 0.9 positions. I think I've got a 0.75. I think at the end we're going to ask, is there anything you're interested in hearing about? I would like to know, like, what are you guys looking for? And so we'll look at that at the end. Let's see. What else did you ask about as far as our vacancies? What are we looking for? So I always like, when we have experienced ICU nurses apply, but we also, I look at who is maybe lesser experienced, but that we could bring in and really, because some of the lesser experienced people are really looking for learning opportunities and because they've maybe worked elsewhere and didn't have that chance. And we want to bring those people in and give them the chance to learn these different therapies and advanced skills that we have available here. Versus the experienced nurses, they can come in and then they can be mentors. And so we're looking for all level of skill. And I think it brings a diverse perspective to the ICU, and I love having diversity of thought and just people from all different backgrounds. I think that's important, and that's another thing I really like about O'Connor. I think this is probably the most diverse staff that I've ever managed, and I see that as a good thing. It's actually really great for our patients too. We have Vietnamese speaking nurses, Spanish speaking nurses. We've just got a whole variety, and I think that's important for our patients. Beth is pretty fluent in Spanish as well, so it's exciting that we have all these different types of nurses here.
That's great. That's awesome to hear. And we really emphasize on diversity here. That's what the County of Santa Clara cares as well. And I see a lot of nurses agreeing to what we're saying about O'Connor Hospital. They're saying, yes, I love O'Connor Hospital. This is why I enjoy working here. And thank you, everybody, for agreeing with what we're saying. Yes. And I just want to make sure there will be Q&A session in the end to address each question. I'm sorry if I can't address them right now one by one, because there are a lot of questions being asked right now. Some questions is asking about opportunities for reimbursement. Yes, so there are opportunities for education depending on what is required for the specific position, but the county definitely supports continuing education as needed. Thank you for that question.
Ariana, may I add on? I think just another example of how the county really actions speak, to what our philosophy is. there's reimbursement for certification here within the county. So every year we have to remind everybody, put in for your certification, because there is reimbursement that goes with that too, and it's for national certification pay. So I think that really speaks to our philosophy, is that we support that.
That's great. Thank you, Juana, for sharing about that.
So Oriana, I see somebody asking about what does the 0.75 and the 0.9 mean. So I just want to explain that. So we are hiring their 12-hour shifts. So a 0.9 would be 6 12-hour shifts in per pay period, which is a 2-week period. And then a 0.75 is 5 12-hour shifts in a pay period.
Thank you, Karen. I hope that answers your question. There is also a question about training programs. Can we talk more about what to expect in general for training programs? How long and what should be individuals expect from these training programs?
Sure. So we have been offering a critical care training program, and it has consisted of around 14 weeks, give or take. We like to assess people at the end of that 14 weeks. And throughout the 14 weeks, they may need a little extra time, but the goal is a training program for 14 weeks. And Beth is actually one of our preceptors for our critical care training program. So the training program consists of didactic classroom time in combination with clinical time with a preceptor on the floor. In management likes to meet every few weeks just to check in, talk with the preceptor and preceptee, just see what kind of experiences and opportunities people need to feel comfortable being off orientation.
Awesome. Great information.
Could I add to that? So like if you're also talking about somebody like myself who's already an ICU nurse, but you want to do something else like CRRT and you're wondering what that looks like, usually there'd be like a class, and then you'd have one-on-one orientation with somebody, with the machine, with the thing, so that you were comfortable with caring for a patient on CRRT. So that's kind of what it looks like if you're doing something like new in your practice. Something I really love about O'Connor is that if you're not comfortable after one shift, that doesn't mean you don't get to do it. We want you to be comfortable. We want you to be confident in what you're doing and excellent in what you're doing. So, you are able to have an input in how much training you need. If you've done it for years and you feel really, really confident after one shift and stuff, then that's great. But if you're not, like it's been 5-6 years or something and you want an extra shift, like that is something open to discussion, which is really, really great too. So.
And please, thank you. That's excellent. Again, it goes to our philosophy of in nursing, we really want to support the educational piece. When I was a new grad many, many years ago, we got 6 weeks, and that was it. It really didn't matter if you were ready or not. You were on the floor as an independent caregiver the next day. And I always said if I was ever in a position where I could change that, I would make sure that we could. And again, based on the feedback from our leaders and our education department, which, by the way, we have an amazing education department here. I just have to put that out there. Definitely, we hear their feedback. And again, it's about doing the right thing for our staff and our patients. So I just want to, Beth, thank you for mentioning that training.
Thank you. Thank you for bringing that up, Juana. There's actually another question about what is a successful candidate for ICU and what can I expect from the recruitment process? I can answer in terms of recruitment process, how do I apply? Can you talk about the ICU piece?
Sure. So, I'm looking for someone that, so ICU can be a tough place to work. It's a stressful place. So I like to find out, how people deal under stress. That's something I kind of get out of when you interview. Dealing with conflicts always come up in nursing, not just ICU. I like to see critical thinking, so there's some questions I ask just to see about critical thinking and can you think through a clinical scenario. So those are the types of things that I look for. But the main thing is like, are you nice? Are you kind? Are you compassionate? I look, when you answer questions and give me examples, I'm looking for people that really show that they're compassionate and caring, because that's what our patients deserve. And so that's some of the things we're looking for when we are hiring nurses.
Awesome. And there are a lot of great questions flushing in. I love these questions. How can I apply to ICU training program? As I'm out of ICU setting for 4 years.
Oh, I can take that one.
Sure.
So we are planning another critical care training program. It'll probably be in the fall. As Karen says, these last anywhere from 13 to 14 weeks. So we are just starting our second one right now. So the process will be, we announce it, and Karen can speak a little bit more as far as the different points if you're an internal employee, an external candidate. But we will be having another one in the fall. Karen?
Yeah, so I tell it will say Critical Care Training Program O'Connor. And yes, in the fall, we're planning on posting another one. And it is offered to internal candidates first. And then if we don't get enough internal candidates, then it does go to open competitive and would be open up to the outside. And we would interview people from the outside for those positions.
Wonderful. And is there, could you remind me the requirement for experience again?
For the critical care training program?
Yeah.
I think it's just, I think a year of acute care experience. We're just looking for any kind of acute care experience.
Okay.
Yeah.
Okay. But to answer in general, in terms of the county, we always have the clinical nurse 1 recruitment posted that requires no experience, just RN license. And when Karen talked about the 1-year experience, that would be a clinical nurse 2. So when you look on the job board, clinical nurse 1, 2, and 3, there are differences between them in terms of the requirement for experience. I hope that answers everybody's question on that. Yes, I get a lot of questions talking about the hiring process. Yes, so to apply, there are multiple ways to access our career page. You can go to sccjobs.org. That's the county's page, because O'Connor Hospital is part of the County of Santa Clara. So sccjobs.org is where we have all of our opportunities posted. And you just need to go to open competitive opportunities. That means it's open to all to apply. Don't go to transfer or promotional opportunities. Just go to open competitive opportunities. And you can also go to O'Connor Hospital's page. If you look it up online, there is a career tab on O'Connor Hospital page where it provides a lot of process and ways to apply, ways to sign up for interest notifications. You can always sign up for interest notifications. That way you get a notification whenever an opportunity comes up. So that will be how you can apply. And in terms of the hiring process, you will have to create an account on our job board, ATS job tracking system. Our HR colleagues will review your application, and for all of the qualified one, we will refer them to Karen for her review and scheduling interviews. Could you talk more on the interview process, Karen, just to give everybody an idea on that?
Sure. So I usually reach out. So the candidates will receive emails to contact me, and they contact me, and I usually just set up an interview. We have been doing phone interviews with COVID and everything. Eventually I would like to get back to in-person interviews. I think we're getting close to that point where we can start doing that. But usually I go through about 10 questions with people, and then I give them a chance to ask me any questions they have. So it's fairly straightforward interview process. And then usually if people were selected, I like to reach out to people personally and give them a call, and we chat about things so I can answer any questions they have. But also another thing is the county does notify people if they have not been selected. And so I always think that's a good thing too, that you know where you stand after an interview process.
Thank you, Karen. Karen is super fast in terms of contacting her candidates. Whenever I send her applications, she just calls them in 1 minute. So she doesn't wait, which is really awesome, to make sure we have a speedy process. In terms of the county application review process, we do take a day or two or a couple of days to review applications, and we do send out notifications in terms of if we cannot find certain information on your application. For example, you didn't indicate you have an RN license, we're going to email you to collect more information. And you can always respond to the notification you get from us, because there are always somebody behind that notification who can answer your question. Once we collect the information from you, we can move your application forward in the recruitment process. So don't hesitate to reach out to us.
Can I also just throw out there, Oriana, when you're filling out an application, please make sure you include every single job you've ever had as a nurse, because that's how we look at how many full-time years of experience you have. Some people, if they've been a nurse for a long time, they don't include all their experience, but it's really important that you do include all of your experience on your application.
Yes, that's a great reminder. In terms of the application, we would have you list all of your job history, with days and hours you worked. Make sure to list the location you work and what were your responsibilities. And sometimes we do have a couple of supplementary questions to get clarification. So if somebody answers the supplementary question, see resume or see my job history, we're not going to move forward with your application. Rather, we want to collect more clarification from you, because we couldn't find the information we're trying to get from your supplementary question. So make sure to elaborate your experience in the supplementary question. That would be a good practice for everybody. And we continue to get a lot of questions. And I want to circle back to the question when somebody asks, do you hire Lvns at O'Connor Hospital? So Juana says we don't, but
we don't in the ICU. I'm sorry to interrupt.
Okay.
But we do have LVN who work in our subacute. So we're actually different in that our hospital has an internal dedicated SNF. So we do have positions open in the LVN setting for subacute, just to clarify.
Thank you, Juana. Thank you for the information. Yes, I also would like to add, definitely check out our different opportunities at the county and O'Connor Hospital, set up job notifications. Because other than clinical nurse, we have a lot of other opportunities at the hospital, like admin nurse, assistant nurse manager, nurse coordinator, nurse practitioner. There are a lot of opportunities within the county if you couldn't find the opportunities you were looking for. But there are just a tons of opportunities within the county, because we are the third largest employer within the county of Santa Clara. Within the Bay Area, I'm sorry. The county of Santa Clara is the third largest employer in the Bay Area. And are there current openings for ICU positions on the county website right now? Yes, clinical nurse positions are currently posted. I'm sure about that. And my colleague just dropped a link. There's a shortened link that everybody can press onto bit.ly/SCC nursing jobs. I hope everybody can see that. That was typed by my colleagues. And my other colleagues also drop a link in the chat section that is linked to the county career page as a whole. That's governmentjobs.com/careers/County Santa Clara. I hope everybody can see that. This is a great discussion. We're getting a lot of great questions. Do you create an account at the county? Yes. When you are ready to apply, account is needed with your information, which I do have already. If you have an account already, you just have to submit a separated application for that specific recruitment. So you don't have to recreate an account because you only need one account to apply for county jobs. Can PRN float nurses be considered for ICU training before the nurses who are not working in O'Connor?
So I think if they mean PRN, I think they're saying per diem. So anybody that's coded within O'Connor would get to apply for the internal postings, and anybody that's per diem could apply when it's open competitive for an open competitive position.
Awesome, thank you. Is O'Connor a stroke center/trauma center?
We are a stroke center, not trauma center. That would be VMC right across the highway. But we are a stroke center and have been for many years. We just actually had our stroke survey not too long ago, right, Karen?
Correct. And so you will see post-TPA patients in the unit. And then we also just had a few neurosurgeons come on board. So, we're going to start seeing more like craniotomies, like probably EVDs and things like that in the unit.
Awesome. I have outpatient surgery experience. How can I apply for a med surg position? Great question.
That is a great question. So again, make sure that you make an account, and we always have extra help med surg positions, and that would be one way to make sure that your interest is known. And again, if we go through our process and there's no internal candidates that want to take those positions, we do look external, and we have hired, I think, people with a wide variety of skill set. And again, it really is about making sure we bring on the right people from that are going to be a fit with our culture. And it's about being compassionate, and it's about teamwork. I say if you have those two things, you have a leg up on the competition.
Thank you, Juana. That's great information.
That kind of makes me think of another thing to bring up is that, once you get your foot in the door, like to any position here in the county, it's very easy. If you're someone that gets bored easily and you want to move around, it's pretty easy to move through the county system and find jobs that, you're interested in.
Absolutely. Someone asked, is this site just for medical positions? We actually have all kind of opportunity within the county. For O'Connor, it's focused on medical positions, yes. We're looking for healthcare heroes to join us. Thank you, my colleagues, for answering questions in the chat box. Yes, I also want to talk about the perks and benefits because I keep hearing good words about them from my colleagues, from new nurses, or experienced nurses who work at all of the hospitals in the Bay Area, and they came over and they said, wow, your benefits is awesome. The County of Santa Clara, also O'Connor Hospital, we provide a very generous benefit package that takes care of all the employees at the beginning of the career or even after retiring. We have robust, competitive health dental vision benefits. We also is one of the few counties that runs our own health insurance plan, and we can use it all over the place. And it's contribution free for all county employees. We have generous vacation sick hours. We have 13 paid holidays. And lastly, the county's generous employment benefits package continues even after when somebody separates us or retires, because we have CalPERS, also known as pension. For those who are not familiar with what pension is, this is a regular stream of income that you will receive even you are no longer working for life. And the size of the pension that you will receive depends on the number of service years you will work. The longer you stay with the county, the larger your pension will be. And we also have tax advantage investment option like our Fidelity 457 plan. And once you retire from the county with at least 15 years of service, at age 50 or higher, you get free health care coverage for life. Hey, this is really awesome benefit, everybody. Can you tell me how I can pick up for per diem opportunity right now?
So there are per diem postings as well. I don't know if they posted that in the chat, but you can apply for per diem positions right now. There's a posting.
Great. Are there IT positions available? Absolutely. We have a lot of IT positions available across the county. Yeah, definitely check out our career board. Thank you for your question. Let's see. And everybody remember to sign up for job interest card. That is a really convenient tool. So you just check all the boxes of departments or job functions or job categories you're interested in working. And whenever a new job is posted, you will get an email. That is really a great tool. Would it be better to send resumes through online or in person? Karen, will you take resumes?
Yeah, I've had people send them via email. I have had people stop by and hand me their resume. Probably online is the best way to do it right now. I don't know if my email is anywhere, but also you can attach a resume to a job application as well, and I can see your resume.
Awesome. If one of my colleagues can help, just drop Karen's email in the chat box, that'd be great. Do you have ambulatory clinical nurse positions? We actually have 10 ambulatory care clinics across the county. So when we post that, it will be clinical nurse ambulatory care. And definitely sign up for job interest notification so you can get an email notification. And we are definitely hiring nurses for our clinics. Thank you for your questions, everybody. How soon will we have the next training program? I'm not sure if we already addressed that.
In the fall.
Probably
Okay.
around
Awesome.
September.
Great. And I see a lot of people. I love O'Connor Hospital. We're a family there. Yes.
So Oriana, are people able to get like notified if they put something in at the county saying I want to know if there's a critical care training? Are they able to do that? If they're interested in that and get notified when that goes up?
It's actually whenever a hospital healthcare position is posted, they'll get notification for all of them. Yeah, not specifically for a training program, but we can definitely post on our LinkedIn page, our O'Connor Facebook page, LinkedIn page, our county Facebook page and LinkedIn page to promote the opportunity for sure.
And now that you said that, I think it'd be great if anyone wants to follow O'Connor Hospital on Facebook, because you can actually see the culture of the hospital through those Facebook posts and how fun it is here. You know, we do a lot of fun things, flash mobs and all sorts of things that get captured on our Facebook page. And it shows you what O'Connor is all about.
I heard about those. A lot of cute pictures.
Halloween is big here.
Yes.
And Nursing Week is coming up, so we always like to just pay tribute to a little bit of our, nursing past. And I know those people who have white uniforms or white caps. We have a day where we just don that and we take pictures outside the hospital. But it really is about appreciation. So if you go on our website, you can see a lot of the past events, everything from physician appreciation to some of the other events, the different events that we've had, different fairs and different sites that we've had the succulent. We had a thing a few years ago where it was really about, again, well-being, emotional well-being, and there's pictures of our folks doing planting succulents outside, or we did a crane project where we did an origami crane, and we did a art installation in our front of our lobby from all the cranes that our staff made. So yeah,
Yes,
that's a great idea.
pictures. Super cute. I got a question. What is the criteria for critical care nurse 2? Okay, I can talk about different levels of clinical nurse for sure. Clinical nurse 2, we require 1 year in the competency level, which is 1 year in ICU full time. So that will be for clinical nurse 2 critical care. For clinical nurse 3 critical care, we're requiring 3 years of full-time acute care experience and 1 year full-time in the ICU. So that's how they differentiate from each other. Hopefully that answers your question. And make sure you have the hours you work very clear on your application. And I also saw, questions about diversity, statement about diversity. So the diversity is something the county really cares about. The diversity in our workforce is a testament to the county's commitment to promoting diversity, equity, inclusion within the organization through its service delivery. And as stated in our policy, the county believes that the various perspectives generated from different backgrounds, abilities, professional experience, life experience are critical to our success. So this is why the county and our hospitals are a leading public organization, not just in California, but in the US, for sure. That's what we definitely care about.
Can I add something to that?
Yes.
We have a really diverse staff, but we also have a really diverse patient population as well. And I've worked other areas in the Bay, and we can get an exec from someplace, and then we can get somebody from that lives in a tent down the street. And the really cool thing I think about being a nurse here is that you get to help everybody regardless of their background or anything. But we also get like lots of patients that only speak one language. We get lots of patients that have a diverse background, or it's just really cool. There's just a huge diversity to patients here as well. And I think that's really cool that we really get to help so many different people in so many different ways, wherever they're at.
Thank you so much, Beth. That's great information. Rosina has a question about being out of ICU for 4 years. Okay, so we are actually looking for recent experience, Rosina, within the recent 3 years. So you can always try applying for clinical nurse 1 critical care. We actually post that, I believe, once a year or twice a year, and that only requires RN license. Karen, could you talk about what type of experience will be considered relevant ICU experience? I think that's a great question.
Yeah, I know there's some questions about step down. We are looking for someone that's been in the ICU, that has cared for ventilators, vasopressor drips. So it depends on what kind of step down. I would maybe consider, when I do the interview, kind of one of my first questions is getting an idea of what your background is. And so if you've been in a step down where you actually have cared for, you got patients on ventilators and vasopressor drips and all of those things, we might be able to take that experience into consideration when we look at that.
Sounds great. I have questions on how CJ says she's interested in ICU positions, floated to ICU and picking up her DM now on any floor. Can she contact HR? Hey, I didn't talk about our email address. So yes, we are behind nurse talent at esa.sccgov.org. If anybody can drop that in the chat box. So we're at Nurse Talent at esa.sccgov.org. So you can always send us an email. We'll try to answer your questions. And you can also, CJ, you can also email Karen. We also had Karen's email in there. So we are very welcoming. So we will welcome all type of questions. Don't hesitate to reach out. This is wonderful. Great. I don't see any new questions. If I didn't address your questions, please type it again in the chat box. We'll try to address them, and we have 8 minutes left, and we really enjoy everybody being here with us because I don't think a lot of people are aware our hospital is so awesome. Oh, CJ cannot see comments. So CJ, if you remember the email address, shoot us an email address.
You can also scroll down if you're in front of a computer. You do have the ability to scroll for the comments, so you can find the link. But maybe can we put Karen's email up one more time?
Could I interject just a little bit here? Some of the things that I get asked a lot are like compensation and reimbursement and stuff. And I just want to say that the county has one of the most generous PTO/sick leave offerings that I've seen. So when I worked at Stanford and El Camino, starting, I got maybe like 7.5 hours of PTO per pay period. And here you get that plus sick leave on top of that. So like if you get sick, you don't necessarily have to empty out your PTO bank to, if your child's sick and you need to stay home with them, you actually have a separate sick leave for that, which is like super helpful because I have a small child at home who of course gets colds and stuff and needs care. So when you're looking at your different compensation, if you're serious about coming to O'Connor, I would just encourage you to look at the big picture too. You're probably going to get more time off, paid time off. You also have the pension that you can get once you vest for 5 years. It only takes 5 years to vest in the pension. And then also, you also have your 457 plan for retirement too. So there's a lot of like big picture things that aren't necessarily like immediate, but they're actually just fabulous when you're a staff nurse or a staff member here. They make your life, I feel like they've made my life a lot easier. And just a lot less worry about like, can I go on vacation next, in 6 months from now if my child's sick or if I get sick or if I got COVID or something like that. And I just really appreciated that over the past year and a half of working here.
Great, that was excellent input, Beth. Thank you so much. Yes, we should definitely talk more about what other benefits our hospital has. Anybody else want to chime in on that?
I think Beth, you did an amazing job summarizing it from really your perspective. And again, I think it's just on the holidays. What I want to add is the holidays are representative of the culture that the county believes in, right? So there's different holidays that definitely represent our commitment to cultural diversity. So I'm very proud of that.
Awesome. Thank you, Juana.
Yeah, I've also felt like, I know Karen's sitting right here, but I would say this to anybody, but I really feel like the leadership here really sees you as a person. You're not just a number. You're not just somebody that makes the hospital money. You are a person and you're a staff member. And so you matter, and I know that's not always the case. I haven't always experienced that in some places. And so that's just something I really appreciate too about the leadership here is that you are a person to be invested in and valued. And I think that when that happens, you're also able to invest in and value, give valuable care to your patients, and really be able to do that. I've been able to advocate to my charge nurse, hey, this assignment's really heavy, this patient's really sick, can you split them? And they've split it like almost immediately. or they would split it as soon as they could. So like if you feel like things aren't safe or you feel like you're just not able to give the care your patients need, you can speak up. And during COVID that was a little hard. You always got help, but that was a little hard always to do. But that was done as soon as it was possible to do. And I just really appreciate that culture here as like an experienced nurse. I've a travel nurse, I've done a lot of places, done a lot of things. I just really appreciate that I can advocate for both myself and my patient, and that's really something that's heard and taken seriously here.
That was excellent. We not only take care of our patients, they're definitely our number one priority, but we also definitely try our best to take care of our own people, our employees, because we're a family here. That was wonderful. Thank you, Beth.
We've also started a shared governance council here in the ICU because I want people to speak up. I want to hear their ideas. And that comes from staff up to me instead of from me making decisions down to them. So we've got a council going that can own their nursing practice and take charge of that. And so we're excited about that here.
That's great. Cora is asking if we need ACLS for a med-surg position.
Yes, you do. Recently, over the last year, we've transitioned to taking telemetry patients on our med-surg, so that is a requirement now.
Great. Thank you, Juana. And we have 2 minutes left. I really want to tell everybody how appreciated I am for everybody being here to talk about O'Connor, to learn about O'Connor, because this is an excellent hospital. We take care of our patients, we take care of our staff. And this video is going to be recorded and it will live on LinkedIn and Facebook. So whoever misses session can always go back and watch the video again. And I'm just thinking about how everybody can get a hold of us if they didn't write down our email. How many med-surg positions do we have available?
Last I checked, we didn't have that many. So you really just have to go on the website. Again, we're hiring, and again, we do have people who want to join us. So those positions do get taken quickly.
Great.
Oh yeah, I did have a quick question.
Yes.
How do people know how to share this or forward this recording to friends?
Yes. So it lives on LinkedIn. If we go to county LinkedIn or county Facebook, it's like a posting right there. So we can always press share. And for those who want to get a hold of us, we also have our O'Connor website. When you go to career, under career, you find nursing. There is an interest card that you can fill out with your name, phone number, your email address as well. So that way you can find us as well. So there are multiple ways to find our opportunities to get a hold of us. So don't hesitate to reach out. And you can also leave us a comment on Facebook where you're watching this live video. Leave a comment on LinkedIn. That way you can get a hold of us as well, because Juana, Karen, and myself, we all have LinkedIn account. We're monitoring our page. So feel free to get a hold of us there as well. Sounds good, everybody?
Yeah, and there's just one last question as far as start dates. So we have orientations every 2 weeks. So if that helps, again, we are, as Ariana says, very welcoming and really working on our process to make sure that it's smooth as possible.
Awesome. Thank you so much. And we're at time. And we are going to say goodbye to everybody. But if you miss this session, no worries. You can always watch it again. Thank you, everybody. Thank you, Karen. Thank you, Juana. Thank you, Beth. And hopefully we can speak with everybody soon. Have a great day.
Bye.
Bye.